Hi Sarah, how are you?
I'm good, thank you. Rachel, are you okay?
Yes, I'm great. So today we're just going to have discussions based around the work you do as a social prescribing link worker. I'm going to turn my camera off, but so you'll be full screen and we'll be able to listen to your answers. Okay? Thank
Yeah.
you. Okay, so let's start with what does a social prescribing link worker do?
Well, it's a very varied role, but ultimately, sort of to try and put it in a nutshell, we're sort of responsible for supporting the patients within our PCN with sort of their emotional and wellbeing needs. So things like identifying isolated patients and offering support to sort of link them into community groups and provisions. Same with people with low to moderate anxiety, depression, people that have maybe gone through bereavements. One of the main the bigger parts of the role is also helping patients that are in a caring role for a family member or a loved one, guiding them to sort of supports in the local area and helping them sort of put together a care plan of sorts. We can signpost to financial services if people are struggling with their finances or housing. We can link people with addictions to sort of drugs and drink, to supportive agencies in the county as well. There's a little bit of overlap with other roles in the sense of we can sort of things like with mobility around the home, we can link into collaborative care teams to sort of help provide patients get the sort of support they need in their homes, that do occupational therapy referrals online, refer people that are sort of struggling with falls into falls services and exercise groups. We can help people that are wanting to lose weight access sort of free or cost-effective support plans in terms of like gym membership and Slimming World and things like that. So it's extremely varied.
It's a vast array of services you offer. Wow, you
Yeah.
must keep lots of people out of the GP surgery then, the
I,
GP room, not the.
I think so, and I hope that that's sort of been noted by some of the GPs, because sort of certainly over the last 2.5 years we've had sort of regular patients that, I mean, I know I have been told sort of one-to-one by a couple of GPs that they have noticed certain patients. They say, "Oh, you must be doing a good job because I haven't seen such and such for months," and they're usually phoning in at least every week to sort of be reassured about something, or just to sort of have contact with surgery. So, yeah.
That's great. Yeah. So do you think you've seen an increase lately in men's mental health issues?
Yeah, I think so. That again, I suppose it's similar in the sense of with anybody, but certainly through COVID, we've had a lot of bereavement, sort of men losing partners, and so they're obviously struggling with grief, and then that links into isolation because they're at home and they either don't know how to sort of manage things that have been previously managed by partners. They just sort of they've obviously had to isolate through the lockdowns, and then they've got more anxiety, and actually the same for younger men as well. I think we've got quite a few, I've certainly at the moment, I've got a few males in their late teens, early 20s that are struggling with anxiety really badly. A few men sort of in their 30s that are going through sort of marriage breakups and are needing support. They're not being able to see their children, or they're financially struggling and need sort of guidance to sort of supports with that kind of thing. So yeah, I think COVID has had a lot to answer for across the board, but definitely noticing the difference in sort of men coming for help now.
What do you think's made them feel comfortable enough to come to you now?
Well, I'm not sure. I mean, I speak on sort of behalf of our PCN. I think the majority of male patients don't actively come to find a social prescriber, possibly obviously because it is still a relatively new service. But when they go to the GP, they are obviously probably in a really desperate position where it's sort of the last straw and I think I need to tell somebody. So they're obviously going to the GP, and they're either going specifically for, I can't cope emotionally, and the GP then refers them to us, or they're going for something else, physical ailment. But in the course of that conversation with the GP, they'll also say, whatever, my marriage is broken down, I've lost a partner, and in that sense, they also get referred to us as well. So I think at the moment it tends to be more referral through other professionals rather than self-referral from men. That's just from my point of view in our PCN.
I think there's been a lot more awareness being publicised from celebrities, and even
Yeah,
Prince William has
I
been
think
talking about it more.
yeah, I think generationally younger people are definitely more open to talking. That's really evident. I'd say majority of older male patients are referred. You know, they're sort of a little bit more reticent, and they'll sort of say, well, what can you do? And it takes, you know, you have to build up that trusting rapport with them over a couple of calls or face to face. And once they see that you're not there to sort of judge them or anything like that, they really do open up. But yeah, the younger generation are more receptive to it, and I think it's just because of the society we live in now. It's not as taboo a subject, which it is for sort of the over sort of 60s. So
Yeah, it's great though, isn't it, that it's opening up, because there used to be that real stiff upper lip, don't moan about it, just get on with it, pull yourself
yeah,
together type of attitude.
definitely. I think as well, it's sort of more, we're sort of aware now as a you know generation that mental health is so much of an issue. I mean, it's just everywhere, and it is equal to physical health. And I'm always saying when I'm speaking to sort of patients, the older generation, and specifically men, when they're like, "But why am I like this?" and what I don't, you know, they're saying I might need to take medication, and oh, I can't do that because then it means I've failed. And I, you know, we say, well, would you feel if someone told you had to take a medicine sort of for a physical condition like your heart or whatever, would you say, oh, I failed because my heart's not working properly, or I failed because my kidneys aren't? And so
Yeah.
when you put it away, they realize the brain is like a functioning organ, like everything else in your body, and you're going to be either reactive to life events that make you not cope with things in a certain way, or it's a, you know, it's a chemical imbalance or what have you. So yeah, I think just having those conversations as well, and having the longer sessions with a patient allows them to sort of talk longer and open up. Whereas obviously with the GP's really pushed for time. They have their 10-minute slot, and they just get to sort of, maybe if the GP suggested something, they can then sort of offload that to us, and we can look at it from all angles. So it gives them the time to do that.
Yeah, that's right. They feel more secure, don't they, in the time constraints. They can actually talk.
Yeah.
Um, so do you think the pandemic has increased loneliness, not just for the sake of men, but women, everyone? Do you think there's been an increase in people feeling lonely and therefore impacting their mental health?
Oh, absolutely. Like, there's no doubt about that. From young all the way through to old, everybody's been affected. You know, I've had supported students at university that have been completely isolated. They've started, you know, what should have been this amazing journey, and they've just been locked away in halls of residence. They've not been able to make friends. In that first year of uni, or they've been just either stuck in their halls or not, or having to learn online. So I've had people that, and that's affected anxiety. And obviously through the isolation, that's increased the anxiety. And then you've got the older generation that obviously couldn't leave. A lot of them couldn't leave the house at all because of their sort of physical condition, and then they're not seeing anyone. You know, you've got the whole generation of people either in care homes, or living in their own homes, that just were being left, you know, food parcels on the doorstep, and they had no human contact that entire time. And a lot of them don't have the technology, so they can't do face to face like FaceTime or Skype. So yeah, it's been huge.
I feel we're going to see the impact of this for a very long time,
Yeah,
because it's changed people's mindsets as well, hasn't it? Their coping strategies aren't
yeah.
what they used to be because they
It's
were
sort of,
restricted in what they could do.
and that's what a lot of the patients I sort of speak to, specifically the ones that are struggling with anxiety, they say, I'm frustrated with myself because I used to be able to do this. I could go and, you know, whatever it is, take the car to the garage and get it sorted. And now it's this overwhelming thing where I think about it for days before, and I don't understand why I'm like this. But then, you know, you go back over their lifestyle for the last year and a half, 2 years, and they've been at home for the majority of it. So you're not having those sort of social interactions, the conversations, and it's like it's any skill, isn't it? So like socializing is a skill of sorts, and if you're not using it, you're going to kind of lose that skill, aren't you? So
Definitely. Yeah, you make very good points. Um, so in terms of resources, so when men would come to you with loneliness issues or perceived mental health issues in whatever aspect, where would you refer them, or what resources are out there for them?
Well, it depends on their exact situation, because loneliness can sort of cover all kinds of things. Like I said, if they've been bereaved, then we will refer. We in our PCN, we've started our social prescribing team. We've started to run workshops from a local community centre where we've been able to sort of get funding to have a room there, and we offer workshops, one for bereavement, peer support for bereavement. So a few people have been able to come along to that, and then sort of through that they're not feeling as isolated and they make new contacts. And we also have a coffee and connect group, so they'll go to the workshops obviously to tackle the issue at hand. So if they're isolated and lonely through having lost somebody, they're in a room full of people that understand, and then they can socialise at the coffee group on another day in the week. We do one for anxiety management, and again they've been able to build connections through that. But it can be very different because you've got people of completely different age groups and lifestyles. So you've got maybe an older person that's retired that's able to come and do that a little bit more easily, and then you've got people that are working, and that's the really tricky part, I'd say, where there seems to be like a gap, because of people of working age. They're occupied all through the day and they need something in the evenings or weekends, and currently, until obviously we have extended hours, that isn't necessarily an option. So it would be for our younger patients, they sort of give us a time when they're able to have an hour's lunch break or something, and we do phone support. And again, if it's something like I'm trying to think off the top of my head, they generally don't, I'd say they generally don't come to us and just say I'm lonely. It will be, the loneliness will be a side effect of something else. So it will be my marriage, so I'm lonely because of that, but I've also got a lot of other problems, like how do I sort things out financially? How do I get support to see my children and contact? So we're helping with all those things, and by being in contact with them every week, it's sort of we're anchoring them a little bit, and they have got someone to talk to. And they do say, the majority of people do say, just having this call for an hour once a week sort of gets me through the week, because I know I've got someone to be completely open and honest with. And obviously when those more critical issues are dealt with, like whatever it is, finances, what have you, we will then say, what do you like to do for yourself? Do you want to go, would you like to meet up to go for a walk and a talk? So that's what we've offered. We sort of can, if they're in agreement, we can link them up with another patient that's in a similar situation that would like to socialise and sort of meet. We've been able to do that a few times. We've actually been able to do that with a couple of our patients that are transgender. So they've transitioned from female to male. So they're then navigating an entirely different sort of world and very lonely, and we've been able to sort of get them together, and they've sort of formed a friendship. So there's just so many different ways of doing it. So I suppose it always goes back to that, what matters to them, and that's what social prescribing is about. It's like listening to, because we might do one thing for one patient, it's not going to work for, the next patient. So
I think it's good that you're linking people with the same sort of issues so they can support each other. They've got peer support then as well as you. And I mean, I think it was a good point that you pointed out the age group, because I'm aware of, they've got these men's sheds, allotment groups, and also walkings. They have walk leaders and a well-being cafe. But if you're working, it's very restricted to what you can do in the evening, isn't it? I mean, I know there are meetup groups that perhaps you send people to, or guide them to, but
well, a lot of the time, particularly with men, even the younger men, they don't really feel that comfortable just go, oh, we're going to send you to this place with young people and you can just stand there and talk. They have to be doing an activity as almost as a safety net, and then talk whilst they're doing the activity, because that's what open up. Otherwise it's too sort of exposing. I think they feel really vulnerable.
I know, that's so true. I mean, I can only talk to my son while I'm driving somewhere in the car. Well, it's not direct, I'm not looking at him. He'll only open up to me if it's kind of, oh, and by the way.
Yeah, and that's exactly like sometimes when we do like one-to-one walks with people, especially the guys, you get a lot more out of them because you're sort of like focused on a direction, and you're talking about being too confrontational. So
Yeah, that's great. And do you give people money advice as well? So is there financial help you give them? I know there's the money advice service,
Yeah,
but in terms of, say, a marriage breakup and someone looking to manage their finances, is there somewhere they could, because that's a big pressure, isn't it? Finance.
that would be something like we would support them to the Citizens Advice Bureau, get an appointment with them, or it'd be Northamptonshire Community Law offers advice like that. Yeah, we ourselves don't sit and provide that direct advice. We'll always link them to the sort of
Mm.
special service. So yeah,
Yeah, that's good though. You've got somewhere to signpost them to all the time.
yeah.
Okay. Anything else you think that's relevant to the audience that you'd like to talk about in terms of social prescribing and men's mental health and loneliness? We haven't touched on the veterans yet, which
Yeah, that's
I think.
something that we do sort of. It's not frequent, I think, because probably because of the area we're in. It's not really a military area, but we do obviously come across a few sort of retired veterans, and I've helped probably a handful out over the last year or so with things like being made homeless after losing loved ones or marriage breakups, and we've been able to sort of utilize services like the British Legion and the local groups, and we've actually managed to stop. We had a really good experience where we managed to use the British Legion. They stopped one of our really vulnerable patients being made homeless, and the money advice service were involved at the same time. So we worked between the three sort of points, and sort of kept the guy in his home. There's SAFA for funding, the Hope Centre, which we've had a few talks as social prescribing, across the county from. And then there's Op Courage, which is a sort of support service for people leaving the forces and sort of reintegrating into civilian life again. And then obviously got the obvious ones like Help for Heroes, and what have you. So there are services out there. It's just, again, you have to tailor it to specifically what that issue is. Obviously, if it's things like post-traumatic stress, you'll go down one route, and if it's sort of funding, you'll look at another. But they're all quite helpful services in that they will direct you. If it's not them that provides that particular support, they'll direct you to the military service that does.
That's great. On the Northamptonshire Training Hub website, I'm compiling a list of all these resources that are
Yeah,
taken from all of the social prescribing link workers across the county. So you will find a whole page of all different resources. Some some you don't. And I think that would be a really useful
yeah,
resource for the team across the county.
yeah.
So,
Brilliant.
yeah.
Good.
All right. And if anyone wants to talk about any issues that have been raised to any of the social prescribers, you can get in touch with anyone at the training hub and we'll put you in touch with someone to talk about those issues. So thank you very much, Sarah. It's been enlightening. It's great.
Yeah. Thank you. Thank you.
Thank you.